CVM News at noon. Now, Jamaica has recently been listed among the countries with the lowest fertility rates across the globe. The country's fertility rate has declined steadily over the past few decades and now sits at 1.3 births per woman. Notably, this is well below the replacement level of 2.1 per woman. Now, this trend reflects broader changes in social and economic factors, including another area of concern, which is the country's low birth rate. Now, this decline has sparked national concern, but behind the numbers are real men and women facing lifestyle and health challenges. To better understand the reproductive health factors, we're now joined by Director of the Hugh Winter Institute for Reproductive Healthcare and Endoscopic Surgery at UWI, Dr. John Harriott. Thanks so much for joining us, Dr. Harriott.
Yes, thank you for having me, Amoy.
All right, so what would you say is one of the biggest misconceptions when it comes to the topic of fertility in Jamaica?
Well, the issue is that patients don't understand their reproductive window, and therefore, when they seek conception, a lot of time they are reproductively aged because the eggs are no longer viable. And what we need to do is health promotion island-wide to promote early health-seeking behaviors, to have patients conceiving at an early, have patients seeking conception at antenatal clinics. We need to broaden the spheres for prenatal assessment of patients where they can be assessed prior to conception to see if there are any deterrents for them getting pregnant.
So, from your experience, Dr. Harriott, what are the key reproductive health factors contributing to Jamaica's declining fertility rate?
All right. As it relates to, from a medical perspective, we have to look at it from a psychological point of view as well as a physical point of view. In terms of the physical context of this, there are male factors, which is significant. Approximately 50% of couples who are in, I don't like the term infertility, experiencing subfertility, which is difficulty or impairment in conception, 50% of males have a challenge. And one of the other misconceptions is that the males will not accept that there is an issue on their side, and it's always that the women are charged with being at fault, and it's not necessarily so. All right, so that's one of the things that we have to be clear on.
So are there any specific medical conditions or lifestyle factors that are becoming more common among Jamaican women or men that could be contributing to this low fertility rate?
Certainly, Amoy. Issues such as obesity, because about 30% of our population have body mass indexes which are categorized in the overweight or obese category. And certainly for both males and females, obesity impacts fertility. There are also systemic conditions that have negative impacts on fertility. Patients with polycystic ovarian syndrome. Lifestyle factors would be like smoking, alcohol, excessive alcohol consumption, and exposure to environmental toxins. Don't forget that the environment in which we exist have or may impact negatively our fertility.
So have you observed any shift in the average age couples are choosing to start families these days, and could this in any way impact fertility?
Well, I would say certainly from my perspective, even though this is anecdotal evidence, patients, and I see a fair number of patients in my private practice who are in a reproductive age group, and patients are shying away from starting families mainly because of economic constraints, because of insufficient social safety nets, workplace environment not conducive, not having appropriate housing solutions, and downright finding that it's too expensive and unaffordable to start a family. So it's important that we incorporate a multifaceted approach to addressing the needs and understanding determinants of childbearing initially, and we have to disaggregate childbearing from child rearing because there are two separate things. So some individuals think long term and say, but the cost of rearing a child is prohibitive. And yes, I can have a child, there's no problem getting pregnant, but who is going to pay the daycare costs when I go to work? Who is going to take care of the health needs of this child when the child becomes sick? And one of the challenges that Jamaican women are faced is that a lot of them, significant number of them, are actually single parents. And therefore, there's a significant economic burden on the females.
So access to reproductive health care, how does this affect, that's reproductive health care and fertility services? How does this in any way affect, these trends that we're seeing in terms of fertility?
All right, so generally speaking, about 15% of the population are actually having fertility challenges. And not all these patients, in fact, the majority of these patients do not necessarily need to have advanced reproductive or assisted reproductive techniques for them to get pregnant. A lot of these patients can be managed medically or because of surgical intervention, so we can do fertility enhancing surgery, depending on the age. For the patients who, the issue in Jamaica is that fertility is not covered by insurance, and therefore any access whether to surgical care or to assisted reproductive technologies is based on self-payment. And therefore, there are inequalities to access, because if you're not able to afford the costs of IVF treatment, then that might be a deterrent to you getting pregnant in long term if you so require this technique.
All right, thank you so much. That was Dr. John Harriet, Director of the Hugh Winter Institute for Reproductive Healthcare and Endoscopic Surgery at UWI. All right, it's time for a break, but stay with us. Sports is next.